In London, this year, there are around 8,000 people sleeping rough on the streets. There are around 50,000 homeless families. And we know that people who are homeless have significant health problems. They might be physical, psychological, but usually a mixture of issues that they have to contend with. I'm Professor Steve Field. I'm a jobbing GP and I'm Chief Inspector of General Practice at the Care Quality Commission. This video is aimed at GP receptionists who are key people in GP surgeries that can help homeless people access those services.
It began when she asked me to leave. I slept on a mate's sofa, but I couldn't get back on track. I told him I'd go to my sister's, but how could I? So I ended up here. I think I need to see a doctor. My stomach hurts. I mean, really hurts. Last time I went in, they wouldn't see me because I don't have an address. I know nobody wants me near them. Believe me, I know. But my stomach hurts. I'm frightened. I need some help.
Morning.
Morning. I'm not registered, but I need to see a doctor.
Sure, where are you living at the moment?
I'm not living anywhere.
Okay, no problem. If you can just fill in these forms, don't worry about the address details for the moment.
I'm not good at forms. All the reading and writing. It helps if someone can do it with me. It's hard for me to tell people I'm homeless. Sometimes I give my last address. But when they ask for documents, I'm stuck.
Under NHS guidelines, there is no regulatory requirement to prove identity, address or immigration status to register at a GP surgery. You do not need to provide an NHS number. A patient must be registered unless the practice has reasonable grounds to decline, and inability to provide documents is not a reasonable ground to refuse registration.
My mate Andre is Polish. He lost his job and he's sleeping on the same patch as me. Can he get help?
Anybody in England may register and see a GP without charge. This includes all asylum seekers and refugees, overseas visitors, students, people on work visas, homeless people and people in the UK illegally. Not everyone is eligible for secondary care, but it's up to the receiving organisation to check that. If you think someone's using fake ID, then you should still register and treat them, but let us know using the resources in your pack.
Reception staff are the first step in all patient experience, so we have to do everything we can to make it as good as possible. When your practice asks for proof of ID or proof of address, some people just don't have it, and if they don't have it, they don't have it. You have to find other ways of dealing with it. Sometimes they could ask for a supporting letter, maybe from a care worker, a family member, something like that. But again, if they don't have it, they don't, because it's about patient care and they need help. I recently had a patient come to us who was obviously very poorly. He had nothing. He had no form of ID, no proof of address, nothing. But needed help, needed to be seen. So I sat with him, helped him fill in the forms. He couldn't do it on his own. He obviously didn't understand a lot of it because he'd been out of the system for quite some time. Sat with him, got it filled in, everything that we could, just enough to get him on the system so he could be seen. He was seen and sent to hospital.
Getting registered is only the start. I don't go to the doctors unless I'm desperate. I can't wait. If I can't see a doc here, I know I'm going to end up in A&E again.
Homeless people attend A&E departments about 5 times more than the rest of the population, and unfortunately are admitted to hospital about 3 times more than the rest of the population. We need to do something about that. And we need to make sure that they can get the GP care that they deserve.
I'm so happy I could see a doctor. It's really helped me. And since I've got my health back on track, everything else is better too.
The story you've just seen was played by an actor. Wayne was created for this video. My name's Stan and I was homeless on and off for 20 years. I now work for Pathway. We're a charity that looks at the health of homeless people, and my job is to involve people with lived experience of homelessness in the work that we do and get them to look at their own healthcare. It's a great job and I enjoy it, and I'm off benefits, I've got a flat, I sustain relationships. And that all began with being able to sort my healthcare out. I found an amazing doctor that I was able to register with, and that put me on a pathway to recovery. So for me, being able to register with a GP was the most important thing.
I hope this has helped you understand a little bit more about the problems that homeless people face when they're trying to access GP primary care services. Homeless people are amongst the most vulnerable in society. They have really serious physical and mental health problems. They need our help. We need to make sure that homeless people can access our services promptly and get the care that they deserve.